Hello everybody, my name is Fred Huerta with Nightingale College, and today I'm going to be demonstrating administration of ophthalmic medication. The first thing we're going to want to do is verify the healthcare provider order, which reads 0.25% solution of timolol, 1 drop to each eye, twice a day. Next, we're going to verify the 6 rights of medication administration, which are the right patient, drug, dose, route, time, and documentation. Next, we're going to perform the calculations needed to acquire the dose we will be administering. In this case, it's going to be 1 drop to each eye, so that's not going to be necessary. We'll gather our supplies, which are going to be gloves, the medication, and tissue, and enter the room. So we're going to knock on the door, perform hand hygiene, and pull the curtain for privacy. Introduce ourselves to the patient. Hello, Mr. Victor. My name is Fred. I'm going to be your nurse today. Could you please tell me your name and date of birth? Great. I'm going to go ahead and look at your wristband, verifying that name correlates with the name in the order. Mr. Victor, before we proceed, is it okay to talk about your medical information in front of your guest? Okay, great. Victor, do you have any known allergies, such as allergies to food, medication, or seasonal allergies that you could let me know of? No? Okay. Today, Victor, your doctor has ordered ophthalmic medication called timolol. It comes in the form of eye drops. It's going to be 1 drop to each eye. The medication is a beta blocker, which reduces the pressure in your eye. Some side effects that are common are stinging upon administration, blurred vision, or nasal stuffiness. Some adverse effects we want you to let us know if you're experiencing right away would be chest pain, shortness of breath, or generalized weakness. Do you have any questions for me? No? Okay. Okay, so next we're going to go ahead, and if the patient wants to administer the medication themselves, that's perfectly fine as long as the nurse is supervising them and they have performed the cleaning that was needed prior. So to proceed, we're going to have the patient laying in a supine position, or if they're in a chair, hyperextending their neck. And then we're going to wash our hands. Go ahead, wash your hands, put on gloves, and grab a tissue. So I'm going to go ahead and grab a tissue. With my non-dominant hand, I'm going to go ahead. I'm going to just move it over here a little bit. I'm going to go ahead and from the inner canthus to the outer canthus, be cleaning. From inner canthus to outer canthus. Now a new section of the tissue. Inner canthus to outer canthus. If there's crust on the patient's eye, we can apply a warm washcloth, leave it there for several minutes, and perform the same technique to clean the patient's eye. We will be at the same time assessing for any abnormalities such as swelling, bleeding, or discoloration of any kind, or if you see any drainage. Okay, next we're going to go ahead and remove our gloves, and then we will proceed by washing our hands again, and then put on new gloves. These are going to be our new gloves, and we'll then uncap the medication, making sure this medication correlates with the name on the order. So for our third verification, and then with our non-dominant hand, we're going to have a tissue pulling down on the patient's lower eyelid, not on the eyeball itself, but just on the cheekbone. So pulling on the eyelid, on the skin, exposing the conjunctiva sac. With the right hand, we will place it on the patient's forehead, and we're going to be 1 to 2 centimeters away from the site, and then the drop should land on the conjunctiva sac. While when it lands, we're going to put light pressure on the nasolacrimal duct for 30 to 60 seconds. Once we do that, we can go on to the next eye. So we're going to, with the new section of the tissue, now we're going to pull down on the patient's eye, on the patient's eyelid, exposing the conjunctiva sac, being 1 to 2 centimeters away, and then bam. Then we're going to hold here for 30 to 60 seconds. on the nasolacrimal duct. If the patient blinks or if you miss the administration, if you miss the drop, it doesn't land on the patient's conjunctiva sac, you'll have to do that all over again. Okay, so that's 30 to 60 seconds, and then we'll dispose of our supplies, cap the medication, remove our gloves, and then thank the patient for the time. Thank you, Mr. Victor. If you arrange the patient so they're comfortable, I'll give them here's your call light, here's your bedside table. I opened your curtain. Okay, got the fall risk precautions on, and remind the patient if they're experiencing adverse effects to let you know. Mr. Victor, if you're feeling chest pain, shortness of breath, or generalized weakness, please let us know right away so we can help you out. Okay, so next we're going to go ahead and perform hand hygiene, leave the room, and document what we performed.